everyone. My name is Zhu Yaqi. I'm from Maternal and Child Health Hospital of Hubei Province, Department of Clinical Laboratory. First of all, I would like to thank all organizers for holding this contest and establish a platform to study with each other. My topic is application of metagenomics like acceleration sequencing in a febrile 5-year-old patient with neutropenia. Now, I will introduce this case from the following aspects. Firstly, I will introduce the introduction of this case. I have 3 questions here. The one is, what's febrile neutropenia? Patients with FN are a special patient group. Fever may be the only sign of infection. Infection-related morbidity is high if the appropriate antibiotics are not given in a timely manner. Therefore, for the well-list of patients' risk of FN, it's important to reduce incidence and mortality rates of it. The other one is, what are the deficiencies of conventional methods used to identify the pathogens? Blood cultures, microbiological smear, serological examinations, and PCR. The methods mentioned above usually bring us some confusions and challenges that can't be ignored. Here are listed specifically, so I will not elaborate. The next one is, what's mNGS? mNGS is based on high-throughput sequencing of nucleic acids in clinical samples. The known genome sequences of pathogens included in mNGS database have listed above. Many kinds of pathogens can be quickly and objectively detected without any specific amplification. mNGS technology has been incorporated into various diagnostic guidelines and validated by expert consensus. Secondly, I will present the main medical history of this case. The patient was a 5-year-old girl. She was admitted to our hospital with a pale complexion and a paroxysmal dry cough with no obvious cause. The other specific symptoms have listed here. For example, she had an anemic appearance, enlarged lymph nodes were palpated in her bilateral leg, and so on. The patient accepted routine blood tests, conventional coagulation examinations, morphological analysis of peripheral blood cells, and concentration of CRP in outpatient clinic on the day of admission. The above results largely indicated that the patient had inflammation, abnormal coagulation function, and blood-related disease. In addition, the patient also underwent testing for gene-banded chromosome analysis, hematological tumor immunophenotype, bone marrow cell morphology, and histochemistry, as well as pH-like gene mutations and field expression analysis. Based on above results, the patient was finally diagnosed with standard risk of acute lymphoblastic leukemia. Thirdly, I will introduce the case analysis. This patient has recurrent fever for about 20 days during hospitalization. She had severe minor suppression during chemotherapy. Her serious neutropenia occurred early, rapidly, and was long-lasting. The above symptoms suggested that the patient had a severe infection. We wondered which pathogens infected her. We attempted to identify the specific pathogen using blood culture for 3 times, but it was disappointing that we obtained no satisfactory results. So we predicted that blood culture were recurrently negative, probably resulting from the difficulties or impossibilities of microorganisms cultures in vitro. Ultimately, we chose the mNGS technology and were delighted to find that the specific sequences match with aspergillus flavors. We analyzed and predicted that this kind of fungus induced this patient's recurrent fever with inflammation. This diagram shows the specific therapeutic regimens according to the disease status. This is horizontal axis, represents the date of hospitalization. This is vertical axis, represents body temperature of the patient. Clinicians adjust the antimicrobial combinations and drugs concentrations on the basis of invasive fungal disease guidelines. A combination of these 3 drugs was eventually adopted and then controlled her disease progression. In summary, the relevant clinical laboratory examinations greatly helped clinicians in the diagnosis of this patient with CSR-ALL. Particularly, MNGS played an important role in determining the specific pathogens and guiding the clinical antibiotic treatments in this case. This patient achieved good therapeutic effects with appropriate and targeted medications, confirming the accuracy and reliability of the laboratory reports that we provided. In the end, what consideration and conclusion does this case bring to us? According to change of the laboratory indexes of the patient during hospitalization, she obtained body temperature stability, remission of myelosuppression, and normal routine blood results before hospital discharge. This case is one of the typical examples of successful clinical amplification of MNGS. As we know, blood culture has been regarded as the gold standard for diagnosing bloodstream infection, although most microorganisms can't be cultured. Whether MNGS will be the new gold standard in infectious disease diagnosis in the future has remained uncertain. Thanks for your listening.